Hello dear learners, I am Amit Belekar from Tips and Tricks by AMB. Welcomes you to my channel. Before moving further, if you still didn't subscribe to my channel, please click on subscribe button and click on bell icon to get notifications of all my new videos. Today in this presentation we are going to discuss about very important part of pharmacology, that is plasma half-life and its significance. After going through this video, the learner will be able to define onset of action, define duration of action, define plasma half-life and describe significance of plasma half-life. Before dealing with plasma half-life, we will see what happens after administration of single dose of a drug. If we plot a graph of time after administration of drug versus concentration of drug in blood, we will get a bell-shaped graph. Initially, drug concentration in blood is 0, but after administration of drug, due to its absorption, concentration of drug in blood increases to a certain concentration. At this phase, rate of absorption is greater than the rate of elimination of the drug. That's why concentration in blood is increasing with the time. After certain duration, rate of absorption and rate of elimination becomes equal. At this phase, concentration of drug in blood remains constant. But after some time, as all the drug from the site of administration is absorbed, rate of elimination increases than the rate of absorption, and thus it leads to decline in the concentration of drug in plasma or blood. For every drug, its specific minimum concentration in blood or plasma is needed to produce the therapeutic effect of that drug. Below this concentration, we cannot achieve therapeutic effect of that drug. Thus, in this case, assume this concentration is 8 mg per deciliter. Thus, below this concentration, we didn't get effect of the drug. When concentration of drug reaches above it, we will get therapeutic effect of that drug. This minimum concentration of drug in blood or plasma required to produce therapeutic effect is called as minimum therapeutic concentration, or it is also called as minimum effective concentration. When concentration of drug in blood reaches to minimum effective concentration, then effect of drug starts. Thus, the time after administration of drug at which drug concentration in blood or plasma reaches to minimum effective concentration and initiation of therapeutic effects takes place, it is called as onset of action of that drug. After that, drug concentration remains above minimum effective concentration for a sufficient duration, and then its concentration in blood falls down. It leads to loss of effect or end of effect of the drug. The duration for which drug concentration in plasma remains above minimum effective concentration, that is MEC, or the duration between onset of action of the drug and loss of effect of the drug, is called as duration of action of that drug. Understood? The concentration of drug in blood or plasma should be below a specific concentration. If drug concentration reaches to or above this concentration, it leads to development of toxic effects. In this case, assume 13 milligram per deciliter is this concentration. If drug concentration reaches to or above this concentration, it may lead to toxicity of that drug. This minimum concentration at which drug produces toxic effect is called as minimum toxic concentration, or it is also called as maximum therapeutic concentration. To achieve maximum therapeutic effect and avoid toxic effect of that drug, drug concentration should remain in between minimum effective concentration and minimum toxic concentration. This is nothing but therapeutic window of that specific drug. Understood? And the concentration of drug in blood which remains constant is called as equilibrium concentration of drug in blood. Now we are going to discuss about plasma half-life, or it is also called as biological half-life. So what is half-life? Half-life of a drug is the time in hours required to reduce the drug concentration in blood or plasma or serum to half after equilibrium is reached. It is also called as plasma half-life and it is denoted as T half. Let me elaborate this. Here the equilibrium concentration of drug is 10 milligram per deciliter. The duration required to reduce the concentration to half of this equilibrium concentration, that is 5 mg per deciliter, is called as half-life. Equilibrium concentration achieved at about 3 hours after administration of drug, and it remains for 3 hours, that is up to 6 hours after administration of drug. After 6 hours it starts to decline. To decide plasma half-life, we have to consider the time from these 6 hours. Duration required from here to decrease the concentration up to half, that is 5 mg per deciliter, is considered for plasma half-life. Here plasma half-life of this drug is 3 hours. Understood? Now we are going to discuss about factors affecting plasma half-life. Plasma half-life is mainly dependent upon rate of absorption, rate of elimination, or rate of inactivation, or rate of metabolism of drug. Thus, the factors which affect excretion of drug and metabolism of drug ultimately affects the plasma half-life of the drug. The factors affecting half-life of drugs are as follows. First factor we are going to discuss is dose of the drug. Rate of absorption of drug depends upon concentration of drug at the site of action, and rate of absorption affects plasma half-life of the drug. Thus, dose of drug affects the plasma half-life of the drug. Second factor which affects plasma half-life is site of administration of the drug. Rate of absorption by different route is different, and hence plasma half-life depends upon site of administration of the drug. Understood? Next factor is variation in urinary excretion. Rate of elimination of many drugs depends upon pH of the urine. Already we had discussed this in the excretion of drugs. Thus, If pH of urine changes, rate of elimination of drugs also changes. And as rate of elimination changes, plasma half-life of the drug also changes accordingly. Understood? Next factor is inter-subject variation. Drugs pharmacokinetic pattern, that is absorption, distribution, metabolism and excretion, is different in different individuals because of their genetic setup, isn't it? It also affects plasma half-life of the drug. Next factor is age. Already in some of my previous videos we had discussed that the setup required for metabolism and excretion of drugs is dependent upon age of the person. Thus, it ultimately affects plasma half-life of the drug. Another factor we are going to discuss is protein binding. Most of the drugs are distributed in the body by binding with plasma proteins. We know that bound drugs are not available for action, metabolism as well as excretion. Thus, highly protein bound drugs remain in the body for long duration and their half-life is large. And drugs which remain free, their plasma half-life is small as these are available for metabolism and excretion. Another factor is presence of other drugs. We already discussed that if drugs are administered concurrently, there are chances of displacement reactions at the level of their absorption, distribution, metabolism and excretion. Thus, one drug may increases or decreases the plasma half-life of other drug. Understood? Last factor which affects the plasma half-life is diseases. Especially renal and liver diseases affect the rate of elimination and metabolism respectively of many drugs. Thus, in these diseases, there are chances of prolonging of half-life of many drugs. Now, we are moving to significance of plasma half-life. First significance is related with accumulation of drug in blood. For a drug which has short half-life, if doses administered after long time interval, no accumulation of drug takes place as drug is rapidly eliminated. Here you can see in case of drug A, its half-life is about 2 hours and should be repeated after each 4 hours to attain effective concentration of that drug in blood. But drug is administered after about 6 hours and hence its concentration in blood remains less than minimum effective concentration and we will not get desired effect of drug. On the other hand, if half-life of drug is long and drug if chronically administered, accumulation of drug takes place in the body. Here you can see that plasma half-life of drug B is about 4 hours and the dose of drug should be repeated after every 8 hours. But here dose is repeated after each 6 hours and hence drug concentration in blood goes above minimum toxic concentration. Thus it leads to toxicity of the drug. To achieve proper effect of drug, the drug should be accumulated in the body till its plasma concentration should reach a steady state concentration between minimum effective concentration and minimum toxic concentration. At steady state, the rate of drug administration is equal to the rate of elimination. If rate of administration exceeds or is greater than the rate of elimination, a steady state will not be reached and drug accumulates in the body at toxic levels. Similarly, if rate of administration is lesser than the rate of elimination, drug concentration falls below the optimal or desired level and the drug becomes therapeutically ineffective. Therefore, it is important to select proper dose and its frequency so that the drug concentration remains in the therapeutic range. Understood? Steady state concentration is not a constant concentration. It is variable and fluctuates between minimum effective concentration and minimum toxic concentration. Another significance of plasma half-life is that 4 half-lives are required for achieving steady state concentration of drug. Generally, after starting of therapy, 4 half-lives are required to achieve steady state plasma concentration and 4 half-lives are required after last dose of drug for 90% of drug to be eliminated. So it is very important that 4 half-lives are required to achieve steady state concentration and after last dose to reduce the concentration to 90% again 4 half-lives are required. Thus, plasma T-half of drug is general guideline for calculating dose and dose intervals, that is to decide dose regimen. Repeated administration of drug is usually necessary to attain effective concentration of drug and effective therapy of drug. The drugs which are eliminated rapidly should be repeated after sufficient short duration. Here you can see that drug A is repeated at every 4 hours to achieve constant effective concentration as its half-life is about 2 hours. And the drugs which are eliminated slowly should be repeated after sufficient long duration. Here you can see that drug B is repeated after every 8 hours to achieve constant therapeutic concentration as its half-life is about 3 to 4 hours. The drug which is eliminated rapidly is having short half-life and the drug which is eliminated slowly is having long half-life. The ultimate aim of drug therapy is to produce steady state plasma concentration. Drug with short half-life attains steady state concentration quickly and loading doses are not required here. Here you can see that drug A is having half-life of 2 hours and effective concentration achieved in 4 half-lives, that is within 8 hours, and because of that there is no requirement of loading dose. While if half-life of drug is long, the time taken to achieve effective concentration is also long and a loading dose will have to be given if rapid if it is desired. In case of drug C, its plasma half-life is 24 hours and to achieve steady state concentration it requires 4 half-lives, means 4 into 24 hours, that is 96 hours, that is 4 days are required to produce effective steady state concentration. So to achieve steady state concentration in case of drug C, a large dose is to be given at the starting of the therapy and this large dose is called as loading dose, and because of that suddenly there is increase in the concentration of this drug in the plasma, and after that we have to maintain this concentration in between minimum effective concentration and minimum toxic concentration by repeating a small dose after certain time intervals, which is called as maintenance dose. Understood? Drugs with narrow therapeutic index, and in patients of hepatic or renal insufficiency, special attention is necessary in calculating dose and deciding dose regimen of that particular drug. In case of drug with narrow therapeutic index, difference between minimum effective dose and minimum toxic dose is very less. A small increasing dose also leads to toxicity here. Hence, special attention is to be given if such drugs are prescribed to the patient. If patients suffer from hepatic or renal insufficiency, metabolism or elimination of all the administered drug reduces. This increases accumulation of drug in the body, which may leads to toxicity of drug. Hence, a special attention is also needed while prescribing drugs to such patients. Now it is time to summarize today's session. In this presentation, we had discussed about onset of action, the duration at which effect of drug starts from time of administration of the drug is called as onset of action. Then we had discussed about duration of action. It is the time duration for which we get effect of that drug after administration of single dose of the drug. We also discussed about minimum effective concentration and minimum toxic concentration. Minimum effective concentration is the minimum concentration of drug in plasma needed to produce the effect of that drug, while minimum toxic concentration is the minimum concentration of drug in plasma beyond which there is occurrence of toxic effects of the drugs. Then we had discussed about plasma half-life. It is the time required to reduce concentration of drug in plasma to half after equilibrium is reached. Then we discussed various factors affecting plasma half-life of the drug. Dose of the drug, site of administration of drug, variation in urinary excretion, intersubject variation, age, protein binding, presence of other drugs, and diseases are the factors which affect plasma half-life of the drug. Finally, we discussed about significance of plasma half-life. Plasma half-life plays very important role to calculate dose of the drug and decide dose regimen for effective treatment in the disease or disorders. Thank you for listening me patiently. If you like this presentation, please click on subscribe button and bell icon to get notifications of further videos. Like it and share it to your dear ones. If you have any queries, write me on my mail address which is given in the video. Thank you once again.